Growing up, I knew my parents were there for me. We celebrated family events. They were there for me when I was sick or needed help. As me and my sister grew up, we knew we could count on our parents. We were so proud to be their children. Today, we are there for our parents, to share in the celebration of their grandchildren or to be there when they are ill or need assistance. They can count on us. And now our parents look to us to take care of them. Hello, my name is Michael Wilsker, and I'll be your host for Always There. I own a non-medical in-home elder care agency called Always Best Care Services, and we talk about at this show issues that face the elderly and their family. And I'm happy to say that this is our one-year anniversary. I hope the information that we've provided has been helpful over the last 12 months, and we look forward to the next 12 months. Today, I am happy to be talking about today seniors and nutrition. And my guest is Jill Gordon. Jill and I have known each other for over 5 years. Jill is best friends with my wife, and they went to Syracuse University together. Yeah. Jill is a registered dietitian and nutritionist. So welcome, Jill. Thanks for coming.
Glad to be here. Excited to be here.
So at the start, what is the difference? Because people always get confused between what a registered dietitian is and a nutritionist.
Right. That's a great question, Michael, because a lot of people think they're interchangeable, and they're really not. Anyone really could call themselves a nutritionist. Anyone who's read a few books on nutrition, a lot of people today have interest in nutrition, can call themselves a nutritionist. But really, a person that has skilled education is a registered dietitian, meaning they have gone through a proper college or university accredited with an internship, and you actually have that credential, which is called an RD. And especially if you are a person who is dealing with a particular medical condition, whether it's diabetes or kidney disease or gastrointestinal, you really want someone who has that medical background and not just someone who's might have read a few books on, what to eat, what not to eat. Someone who really understands the body and have that training. So that's really, you really want to look for that registered dietitian credential. It's important.
So do you have your own office, or do you work in facilities like hospitals?
A couple things that I do, a little bit about myself is, right now I do a few different things. I work at Beth Israel Milton Hospital as an inpatient dietitian. So I see the patients there in the hospital. Again, a lot of that population is an elderly population. On the other end of the spectrum, I also teach an adolescent nutrition class as well.
At the hospital?
No, for Floating Hospital, completely separate for Floating Hospital. I teach overweight and obese teens about nutrition, and that's really, again, starting there. It's about prevention, really, getting them as children into really good habits, healthy habits. So those are the couple things I do, and then I do a little one-on-one counseling as well.
And do you do this in connection with physicians, or they call you in, or you just, how does that work when you come to the clients?
In the hospital, it's really, in terms of the hospital setting, we have to assess the patients and see. Sometimes doctors will call in, referrals for us to see patients. Sometimes they want to, we have to assess if patients are truly at risk, nutrition risk. We look for certain criteria, screening, to see if patients are at nutrition risk.
So we're here to talk about seniors and nutrition. So let's start off with talking about what the common diseases are and issues regarding people that
absolutely.
What is it, what do we call, how do you determine somebody's senior when they're over 60 years old, or is there a time?
That's a good question. I don't know, does it go by AARP? I don't know. Can we use that as
that's the case. I've been a senior for 18 years.
You know what?
Okay.
Yeah, hard to define what that would mean. But some of the common diseases, and a lot of these obviously we've heard about: heart disease, diabetes, osteoporosis, cancer, are all diseases related to aging. But also malnutrition too is really important on the other end of the spectrum. Usually we think of diabetes and heart disease more as people who tend to be overweight, but malnutrition is obviously the other end of the spectrum when we're dealing with hunger. In terms of issues, as we age, certain biological things happen to us. From a physiological perspective, we lose lean muscle mass. That's really important, just part of aging. We lose our muscle. So it's really important to replenish that you know, by protein as well as exercise. Those are two ways to help that. But some of the other issues, you know, we have sensory losses, we might have hearing losses, we might have some issues with our oral health. Some of our seniors have some trouble chewing and swallowing, whether it's with dentures or, you know, need to have softer foods. Something that a lot of seniors do, and I do a lot of counseling in the hospital, is they're having trouble chewing, they're having trouble swallowing. You know, you can change the texture of foods. You can look to softer foods, whether it's, if you like fruits and vegetables, maybe you need to go to more of a canned fruit, you know, or you need to cook your vegetables longer. Or you might need to thicken liquids, for example. Sometimes you have trouble chewing or swallowing. You actually might need to put a thicket type of product, which is available in the market, so you can get something like that with chewing and swallowing. There's also, you know, gastrointestinal issues. Different things change as we age. Constipation is a big issue, you know, as we age, and that's due to a lot of times lack of fluid, lack of fiber, and lack of exercise. But one thing I want to point out with the diseases that I mentioned is, you know, aging is part, you know, as we grow old. I mean, we do age, but disease, this is really important. Disease does not have to be necessarily a part of aging. So I mentioned, you know, cardiovascular diet. It doesn't necessarily have to be part of the aging process. We can help that by good nutrition. That's
Earlier
really
in life, or
anytime, really.
Anytime.
It's never too late. Okay, I spend a lot of time at the hospital talking to people how when you're 83 and they're diabetic and they've never really heard of a diabetic diet, if they're open to listening, you know, even at 83 years of age, to change some things. So it really,
interesting.
I would say, you know, it's really not too late. But the one thing is, the way you eat and how it affects these diseases is going to affect your function. So let me give you an example of that. Like if you're a diabetic and you don't take care of that diabetes, it's unmanaged, that could lead to amputation.
Right.
That's going to lead to decreased function.
Right.
So, you know,
And depression.
And depression, exactly. And if you're overweight, you're not going to be able to, you know, walk as well or do the things you need to do. So, you know, nutrition plays a big role in how we function, you know, as we get older. So it's really critical.
So just, this is a stupid question, but do you then come up with specific diets per the person? I mean, based on what their situation is?
Yeah, for example, you know, and again, we talk a lot about a heart, a lot of people in the hospital are on a heart healthy diet. You know, we use the term heart healthy diet. But the truth of the matter is, all of us really should be on a heart healthy diet. So what is, like, you know, what does a heart healthy diet mean? I can explain a little bit about.
Sure, please do, because I'm sure I'm not on that kind of diet.
Again, all of us, me, you know, kids too. You know, we should be eating, you know, lean proteins. Protein is important, right? We need, in terms of our diet, if you want to look at numbers, 20% of our diet should be protein. Okay, so, and we get protein from chicken, you know, meat, fish, eggs, dairy. Those are all good protein sources. But we want to pick, you know, lean protein. So we want to pick fish and chicken, you know, 2 to 3 times a week. Red meat is not a no-no. To me, nothing is off limits. I feel like we need to enjoy life, and nothing absolutely should be off limits. But should we be having meat that often? Not so often. So a guideline might be like a couple times a month. Eggs, great food. I love eggs. I talk about eggs at the
Aren't they high in cholesterol, though?
Yeah, right? You know what? There's definitely lessening the requirements about how much eggs, meaning we're being a little more lenient in how many eggs we can have today.
Without butter.
What?
Without butter.
Without butter, exactly, without butter. A nice little spray, like a little Pam spray. But eggs are a really good food. They have a lot of protein, they're very filling, and if you're not at risk for a heart disease or anything, you can have up to like an egg a day. If you do have some risk factors, high cholesterol, high blood pressure, you may want to limit that to more to 3 to 5 a week. But it still does not limit, you know, egg consumption at all, because eggs is really such a good food, and they're easy to make, especially if you're a senior. I work with a lot of seniors who, you know, don't cook as much. Obviously, maybe they might live alone. You can microwave an egg. I don't know if you knew that. Have you ever tried that?
I'm sure my kids have.
but you can try that. So eggs are great. Going on with the heart healthy diet, low fat dairy. You know, dairy is important for strong bones. you know, milk, yogurt. The new thing on the market, maybe you've heard a lot about, is Greek yogurt.
Yeah,
Have you
that's
heard-
my wife. That's what your friend Wendy likes to eat. This
Yep.
Greek yogurt. She always sends me to the grocery store. So make sure you get the Greek
And the reason
yogurt.
why is Greek yogurt so popular today? Well, because again, it's very filling, so it's very good, especially if you are looking to lose weight. It's good because it's filling; it ties you over. But if you're also looking for good nutrition, it's double the protein. And like I said, protein is really important. Going back to that lean muscle that I mentioned earlier, we're losing our lean muscle, and the way we can preserve that is by protein. And because protein is our healing nutrient, our healing, our repair, so that's really important.
So is that why people, Greeks live longer because they have Greek yogurt and drink a lot of wine?
That could be.
That could be?
You know what? That absolutely could be. Yeah. And the heart healthy diet going on, fruits and vegetables. I can't say enough about fruits and vegetables. Why do we need fruits and vegetables? That's where we get our vitamins. That's where we get our minerals. And every fruit and every vegetable has a different vitamin or mineral that helps us in some way, whether it's, you know, whether it's with our eyesight or, you know, our hearing. They all have, you know, we eat the rainbow. I don't know if you ever heard that expression, but eat colors. You know, eat colors. You notice fruits and vegetables all are colorful, whether they're, you know, purple grapes, red strawberries, you know, blueberries, yellow bananas. They're all rainbow. And the colors in fruits and vegetables are from their phytochemicals, which help with cancer-fighting properties, so antioxidants. A lot of people have heard the term antioxidants before. So a healthy diet really is just what everyone should be doing. You know, in terms of fats, you know, fats, a lot of people look at me, fat is not the enemy. We need fat in our diet. 20% protein, 30% fat. Okay, so when we talk about healthy fats, we talk about canola oil, olive oil, nuts and seeds, avocados, those are our healthy fats. When we talk about our unhealthy fats, we're talking more about saturated fats, like fats from chicken with skin, cured meats, butter, high-fat dairy. Those are the fats that we want to not have as much of. Not forbidden, but we don't want to have as much of. Trans fats, have you heard of trans fats?
Yes,
Those are the ugly fats.
ugly fats. Right.
Those are the fats we don't want any, because it's like a Twinkie.
Yeah.
We all remember Twinkies. This audience remembers Twinkies,
That's
right?
Absolutely. They're back now.
Yeah, they're back now.
We have a box in the house.
And you can have a Twinkie for 5 years.
Right.
Why? Because of everything they put in it to keep it shelf stable. Those are the trans fats. Not good. You know. So carbohydrate, and we didn't talk about carbohydrates, right? Carbohydrates is our third nutrient. We have protein, I mentioned. We have healthy fats, and we have carbohydrates. 50% of your diet. So, do you hear a lot about people are like carbs bad, carbs?
Yeah.
It's not that carbs are bad. We need carbohydrates. The brain needs carbohydrates. So 50% of your diet. But should it be cakes and cookies and sweets? No, but should it be more whole grains, whole wheat breads?
Right.
Fruits have carbohydrates.
Oh, okay.
Some people
That's
don't know.
easy.
Some people don't know that, right? Fruits have carbohydrates. Yogurt is a carbohydrate. Milk is a carbohydrate. So those are, you know, good forms of carbohydrates. So we need carbohydrates. So that's really, you know, the healthy diet.
So when you come up with a plan, let's just say, since we're talking about seniors, is that typically after they've had an incident and they've gone to the hospital, now they're in rehab and now they're going home? Or is it more typical that the family will say, gee, mom, gee, dad, I think you better start looking about coming into a diet that would make you feel better?
Yeah. Both, really both. I run into a lot of both. Sometimes, you know, if you've had a stroke, for example, that could call me into, you know, the room with the patient. Maybe after the stroke, they've had some, like we talked about earlier, chewing or swallowing issues.
Right.
So that might need, their diet needs to be modified. I would go over, what does that modified diet look like in terms of texture? They might not be able to swallow as well. So we might need to, you know, like I said, chop the foods up really well, or puree the foods, or different things or thicken the liquids. So it could be that, you know, they might have issues with, you know, just basic things, even just opening, you know, containers and things like that. We might need to talk about things that are easy to open and not as difficult. Just they might have some, you know, difficulty in movement. The other thing, you know, with stroke, for example, is something I didn't mention, which I do want to, is sodium. Sodium is something also going back to the healthy diet, but also like after a stroke or heart failure. Heart failure, when people are accumulating fluid, you know, too much fluid in their bodies. Sodium is probably one of the most hardest, it's a mineral, you know, to control. It's very difficult to control sodium. It's not so much from the salt shaker or cooking, it's that it's already in a lot of foods. It's in a lot of processed foods, packaged foods, sauces, condiments. So what I always recommend to patients is the best you can, try not to eat the, you know, packaged processed foods. You know, try to read a food label and look at a food label and look at the sodium. The guideline a little bit is like 140 milligrams or less. If you look at the big picture, 2,300 milligrams is a teaspoon of salt. It sounds like a lot, 2,300 milligrams, but it's really 1 teaspoon.
Right.
And that should be our daily requirement. As you age, and if you have risk factors like stroke or heart disease, that number goes down to 1,500. It's very easy to get to 1,500 milligrams. Like if you go out to a restaurant, most restaurant
Right.
meals
A lot of salt.
probably have 1,000 to 2,000
Right.
milligrams. So
Right.
you've already kind of wiped out your.
Right.
So I always tell patients, do the best you can at home. When you go out, it's hard to control. So when you're home, try to be mindful, you know, of the sodium and reading the label and make sure it's 140 milligrams less a serving.
So, do you once you provide these plans, again, they're specific to each person. Do you say, for instance, you provide you go over a plan with somebody who's coming out of a rehab, they go home. Do you then oversee their diet, or are you just okay now?
I don't,
you're
but
on
the
your
thing
own?
is where the next step comes in with that is a lot of patients, I recommend outpatient counseling. So I'm an inpatient dietitian, right? So I see people in the hospital during critical illness times. And a lot of times, sometimes they're not able to even receive that information as well. You know, they're not feeling good, they're sick. So I always recommend going to see an outpatient dietitian, which a lot of hospitals have, and there's a lot of, like, again, make sure it's a registered dietitian, because if you have a health condition, like I said, you know, a diabetes, or, you know, you've just had a stroke, or your celiac disease, or anything, you need different textures, you want someone who really has expertise, so you can go see an outpatient dietitian. That's when you would go and have like more like a 1 hour appointment. And then maybe you would have a follow-up appointment in 6 weeks. So that's where the check-ins come in, and someone's really overseeing and seeing, especially diabetes, you know, complex with medications, really important. I always encourage, I give them education there in the hospital about a diabetic diet, but I really encourage them to go and see an outpatient dietitian after you've seen me, and I give them some recommendations.
Well, that's interesting, because the focus when people come out of rehabs or hospitals is physically. It has nothing to do with the nutrition. They have a visiting nurse, they have an occupational therapist, and they have a physical therapist. But they don't have somebody there, which is probably one of the most important
You make
parts, is
right,
to have a nutritionist.
right. You know, Michael, that's like an excellent point, and to be quite honest, I have never really thought about it. I understand all that now that you're saying it and bringing it to light. It's true. I think that people are very concerned with your physical and how you're rehabbing physically. But I don't think that even, to be honest, doctors are really truly understanding the impact that nutrition plays, you know, with going back to how you function. I mean, if that diabetes is under control, you know, you're going to live a much healthier, fulfilling life. If it's not, you know, if your diabetes, if you don't know your numbers, know what's going on with your body, and, you know, you're not managing those blood sugars, like I said, it could lead to amputation. It could lead to kidney disease. It could lead to eye issues. So, and that's all nutrition. You know, and I think that we're starting to see a little more importance in nutrition. For example, even like obesity, I think is being recognized now as a service that could be covered, you know, by insurance, which it wasn't before.
What role does the medication that somebody's taking in light of their diet? Do you go over their chart to determine what kind of medication they're on and how you then bring that together with the diet?
Certainly, there are some medications specifically that we know that can impact diet. For example, a lot of elderly people are on Coumadin as a blood thinner.
Right.
That's one in particular that comes to
Right.
mind. And there's certain interactions they need to understand while they're taking Coumadin, that some Coumadin thins your blood. We have vitamin K in our body, which clots our blood. We have fruits and vegetables that have vitamin K in them. So a person needs to understand those fruits and vegetables when they're eating fruits and vegetables that have vitamin K, how much of them they can have and how it impacts their Coumadin levels. So we do talk about that, a little with medications. To be quite honest, there's not too many really that really have a lot of food. Coumadin is one that comes to mind.
Right.
There's not too many that have a lot of interactions, but we would go over that. That would be something that we would.
Do you also talk to the physician about the diet, or that's something that he just leaves to you? And
You know what? I think physicians, what I've seen at the hospital, and I think this is good that nutritionists are getting more of a role and importance, because quite frankly, the physicians are so busy, and they're just kind of that front line trying to get the person
Right.
well. They're
Right.
trying to make the person feel better at that
Right.
moment, whether it's, looking at their lab values, changing things, medications. They're not as focused on nutrition. To be honest, I wish they would be. I wish they were a little more focused. And sometimes you have one that's really will seek us out, and say, I really want you to give this patient diabetes counseling, or, a low sodium diet or high fiber diet, different things like that. So I see it's happening more and more, that they're getting more involved.
yeah, I think there should be more of what I do, when the people come home, it's to be preventive, so they don't have to go back into the hospitals, to make sure they don't fall, to make sure they're taking their medication. It seems like what you do is also preventative, so that they don't have to go back in. If they have a healthy diet, the chances of them having to go back in are much smaller as a result of that. Is that right?
Absolutely, absolutely. I mean, diabetes is something, people come back in because, their kidneys aren't working, or they're having a lot of skin issues, like wounds and things like that, like diabetic ulcers,
Right.
things that aren't healing, because they're not focusing on, a diabetic diet. And if they did focus on that, right, they wouldn't get an ulcer, things with the kidneys wouldn't start to happen. So if we can get them to understand the importance that diet plays, and just by changing things, and I say to people, it doesn't have to be, a life-changing event all at once. It's small steps, and it's okay to evolve to get to a better place. I really try to give them some baby steps, and if, because before you know it, over the course of 6 months, a year, those small changes turn into big changes. So that's important, because it can be overwhelming, for some people.
What do you think about the diets that are prevalent out there, like Weight Watchers? And one of the patients comes to you and says, I definitely want to go on a diet. There's the Weight Watchers diet, or any other types. I'm not just pointing out Weight Watchers.
Weight Watchers, right. I
but-
think Weight Watchers is a good, I think Weight Watchers is a good diet in terms of portion control. I think it's really important that people become in touch with what they're eating and how they're eating. When I say how, I'm in terms of mindfulness. Like, are you eating because you're hungry? Are you, eating because you have food in front of you? So they become in touch with portion sizes. That's what Weight Watchers helps you with, which I think is a really important skill. So I like that about Weight Watchers, because it really gives you the calorie range. And bottom line is, calories in, calories out.
Right.
The thing I don't like about Weight Watchers, to be honest, is
Well, I don't want to just go into Weight Watchers
Yeah.
here, because I'm just saying in general, these diets
right,
that are
right.
on the...
I always feel that there's always, if there's a good thing that can come out of, if there's a way that people can evolve and get to a better place, then, it's good. And everyone's individual. So whatever someone can connect with, whatever you're going to do, like if I said to you, Michael, I want you to go run, that's a good exercise. And you said, I don't like running. It's not going to work. You know what I mean? And
right.
even I do that with food. Like if I say to someone, I think peanut butter is a great food. I don't like peanut butter. I'm not going to tell you to eat peanut butter. You know what I mean? If it's so, it needs to connect.
Right.
So I
Right.
think the diet or whatever is going on needs to connect with the person, because that's what they're going to do.
You brought up exercise. What role does exercise play in this whole?
Huge, 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 huge. I have to tell you, I don't underestimate the importance of exercise. As we get older, I don't care how old you are, in your 80s, because like I said, you lose that lean muscle. Exercise can help with that. Weight-bearing exercise is really important for that. I don't care if it's, 1 pound weights, or you're walking, around the mall, or you're just parking a little farther to walk, because when you move, so many good things happen. When you move, for example, if you're a diabetic and you eat foods and your blood sugar, you have sugar in your blood. We don't want sugar in our blood. We want to move to our cells. So when you
Right.
move, the sugar moves. Heart, we want our blood to flow nice and evenly through our arteries and veins, right? So when we move cardiovascularly, the blood, is moving nice, flowing nice, and you're getting the nutrients. Constipation, I mentioned before. When you move, constipation is a part of the aging process. And so when you move, it also, things move through your digestive tract. So for your brain, we need oxygen and nutrients to the brain. So when you move, so I can't underestimate, 30 minutes a day is really the recommended, 5 days a week. So, and even if you have to start small, that's okay. Like I say to people, start small, start little walks. Like I said, in the winter, walk around the mall. Little things. It's all good.
Playing golf is good then. Walking
Absolutely.
on a golf course.
Absolutely. Walking, mowing the lawn right now. If you want to mow the lawn, breaking leaves, vacuuming. We kind of
Just where you're moving around.
we discount
It's the
those
solitary.
household chores, but
Right.
truly household, it matters.
Yeah.
Everything makes a difference, and all adds up. One thing I really like is a pedometer.
What's a
Have you
pedometer?
pedometer? Have you heard of one of those?
No.
It's a little instrument you can buy, like at a Walmart, and it counts your steps. It actually counts how many steps you've taken during the day. And I don't remember specifically, but say, there's whatever it is, like, 4,000 steps or in a mile, whatever that would be. You can kind of see how much you've done in a full day, and you'd be surprised.
That's interesting.
And it gets you thinking that if you're in an office building, maybe I'll take the stairs instead of the elevator.
Right.
Maybe, and you see how many steps you've gone, and maybe the next day you're like, what, I'm going to try to get more steps the next day. Little personal challenge, little accountability. So a pedometers are really, it's a good tool.
Yeah, I mean, when I go up a flight of stairs now, I don't go 1 step, I go 2 steps every time.
Yeah.
I'm just in a habit. I just feel better when I do that.
Right. Feel like you're getting a little
Right.
bit of a little
Right.
more of a workout. Yeah.
Right.
That's good.
Well, you've given us a lot of information. I appreciate you coming in. And if you have any questions about what Jill has talked about today, please, you can reach me at Westboro, always there at westborotv.org. Thank you for joining us. Thank you. And
Pleasure.
we hope to see you next time on Always There. Take care now.